Hi, this is Dr. David Green, CEO of Preferred Pain Center here in beautiful Phoenix and Scottsdale, Arizona. Today I'm out at Piestewa Peak, which used to be called Squaw Peak. It's a beautiful area in central Phoenix where a lot of hiking, picnicking, and in days like today when it's 75 and it's snowing in the rest of the country, it's a gorgeous place to hang out for a few hours. The topic for today is Mythbusters. This is part 2 in my recent series of Mythbusters, and today I'm going to discuss 5 myths and whether or not they actually have some veracity to them. The first one is exercise. Some people think that if you have back pain, then exercise is bad because it can make it worse. And that is a complete myth, and I'm not sure who fabricated that, but it's just not true. Now, certain types of exercise may exacerbate back pain. Jogging would be one of those. When you jog, you put multiple times your body weight through your low back. So that repetitive types of stress can be very difficult for someone who's suffering from low back pain. Now, walking, on the other hand, puts much less stress through your low back. They did a study a while back looking at patients who had degenerative disc disease and what types of exercise were best for those individuals. And what they found is that aerobic exercise was best. Specifically, aerobic exercise that included either swimming or cycling, like on a life cycle machine. And the reason is because when you're on a life cycle machine, you're not putting repetitive stresses through your body. And the same kind of thing with swimming. You know, it's anti-gravity in the water, so you do get the aerobic benefit of increased oxygenation to the low back, but you avoid the stresses from the pounding of jogging. So that's a myth. Exercise is very good for your low back health. The second myth is bed rest. People think that if they have an acute flare-up of back pain, they need to be on bed rest for days. Well, that myth has been debunked numerous times over in study after study after study. There have been very large studies showing that patients who had acute strains or acute disc herniations with back pain, that they compared being on bed rest versus trying to get up sooner rather than later. Even 2 days of bed rest can make you worse off than otherwise. And so the best thing to do is, if at all possible, even with acute flare-up of harsh back pain, is to try and maintain your mobility and spend as little time as possible in bed. Okay, so that myth is just that. The third one is sitting up straight. You know, people say, oh, sitting up straight is better for you, it's going to prevent scoliosis, it's going to prevent back pain. There's nothing to support that. That is a myth, okay? You know, sitting up straight might be better as far as etiquette is concerned when you're in a meeting or whatnot, but a little bit of slouching is not going to make you have scoliosis, or it's not going to increase your incidence of back pain. I've never seen a study that actually supported that notion. So that myth is just not valid. Now, the last couple are not myths. One is chiropractic helps back pain. It does help back pain. There's a lot of research to prove that. For instance, insurance companies are now often reimbursing for chiropractic treatment. At any one point in time in this country, 12% of individuals are under the care of a chiropractor. And studies have shown that satisfaction rates for chiropractic treatment are 85 to 87%. That cannot be said for a lot of specialty treatments in this country. So it works, patients are satisfied, insurance is covering it, and it has been shown to help a lot with acute low back pain. It's been shown in some studies to help with neck pain as well. So there's a reason that it's so popular in this country. And the last myth is actually a fact as well, is regarding acupuncture. Acupuncture does help with back pain. There's multiple studies to show for that as well. It falls into the holistic / alternative / complementary type of treatments. But I'll tell you, there are so many studies out there, and they have a group of studies called the Cochrane Collaborative, where they look at all the studies that come out for these types of issues, such as chiropractic and acupuncture. And just like with chiropractic, acupuncture works for low back pain a significant % of the time. And it can work for an acute strain or sprain, it can work for a disc herniation, it can work for arthritis, such as from facet arthritis, it can work for pain from degenerative disc disease. So So it does have validity to it. There you have it. I just debunked or verified 5 myths that are out there on low back pain. If you have low back pain or neck pain or any type of chronic or acute pain, Preferred Pain Center can help. You can call us directly at 602-507-6550. PreferredPainCenter.com has a very active blog, animations, a lot of information to help you out, and we'll get you in very quickly for assistance. I'm Dr. David Green, Preferred Pain Center. Your pain stops here.